Inferior alveolar nerve block. Areas anesthetized are mandibular teeth to the midline, body of mandible, buccal mucoperiosteum or mucoperiosteum anterior to first molar region, anterior two-thirds of tongue and floor of oral cavity, lingual soft tissue and periosteum. Nerves anesthetized during this procedure are inferior alveolar, a branch of posterior division of mandibular nerve, incisive, mental and lingual nerve. Landmarks: deepest portion of the coronoid notch, pterygomandibular raphe, and occlusal plane of the mandibular posterior teeth. 25 gauge long needle is preferred. Area of insertion: mucous membrane on the medial side of mandibular ramus at the intersection of two lines, one horizontal representing the height of injection, other vertical representing the anterior posterior plane of injection. Target area: inferior alveolar nerve as if it passes downward toward the mandibular foramen. 3 parameters for administration of IANB. 1 is height of injection, 2 anterior posterior placement of needle, 3 the depth of penetration. Height of injection: imaginary line extends from deepest portion of coronoid notch to the deepest part of pterygomandibular raphe, determining the height of injection. Imaginary line should be parallel with the occlusal plane. In most of patients, it is 6 to 10 mm above the occlusal plane. The needle insertion point lies 3/4 of anterior posterior distance from coronoid notch to the deepest part of pterygomandibular raphe. Penetration depth: bone must be contacted during the procedure. Average depth of penetration to the bony contact will be 20 to 25 mm, that is 2/3 or 3/4 length of long needle. The nerve is approached from opposite side of mouth over the contralateral premolars. The needle tip should be located slightly superior to the mandibular foramen. If the bone is contacted too soon, less than half the length of needle, the needle tip is usually located too far anteriorly. In order to correct it, bring the syringe barrel around the front of the mouth, redirect the needle until a more appropriate depth of insertion is obtained. If the bone is not contacted, needle tip is usually located too far posteriorly. To correct it, withdraw it slightly in tissue and reposition the syringe barrel more posteriorly. Continue the insertion until the contact with bone is made at appropriate depth. 1.5 ml of anesthetic solution in 60 seconds is usually recommended. Because of high incidence of positive aspiration, sequence of slow injection reaspiration is strongly recommended. Signs and symptoms: subjective: tingling or numbness of lower lip indicates anesthesia of mental nerve, a terminal branch of inferior alveolar nerve. Subjective: tingling or numbness of tongue indicates anesthesia of lingual nerve, a branch of posterior division of mandibular nerve. Objective: no pain is felt during entire dental therapy.